Hello, parents, and welcome to our virtual pediatric campfire chat, brought to you by Crystal Run Healthcare. As pediatricians and parents ourselves, we created this series to open a dialogue to provide education and answers on a variety of topics we know have been weighing on your minds throughout the COVID-19 pandemic. Your Crystal Run pediatrician is a trusted advisor during these difficult times. So sit back, get cozy, and get ready to chat. Well, welcome everyone. Good evening and welcome to our inaugural campfire chat here at Crystal Run. I'm Dr. John Nasser. I'm on location at Camp Crystal Run along with my good friend and colleague, Dr. Pat Lynch. We're going to introduce everyone in just a moment. And back at the office, Dr. Dummett wasn't able to get out of the office today. Someone does actually have to work sometimes, so we felt bad about that, but appreciate her joining us as well. So we're really excited to have you here. This is live TV, so never know exactly what's going to happen, but as I'm sure everyone knows, there are all kinds of different Zoom issues that have happened with people coming onto screens and whatnot. I think we've worked out most of the technical details so we can really get down to talking about some interesting things and topics with you tonight. As I mentioned, this is our first in a weekly series of presentations and question and answer sessions for parents. And we're planning to do this on a weekly basis over the next 4 to 6 weeks or so and give an opportunity for you to join us and have some questions answered about things that are going on medically and for your children here over the course of the summer and even in terms of what's happened over the past few weeks. So this is a webinar version of our presentation. You are in listen-only mode, but you are able to submit questions on the Q&A portion of this, of the Zoom meeting. And so we'll be happy to review and answer questions as we can during our presentation today. So before getting into the heart of the discussion tonight, I did want to let my colleagues introduce themselves and tell us a little bit about themselves. And then also I've asked them to share with you some of the things that they've been doing during this time of being home a lot and social distancing, and in terms of taking advantage of some things and time that they might otherwise not have had. So first, I'm delighted to introduce Dr. Jocelyn Dunham.
So welcome parents, and thank you so much for joining us. So I've been at Crystal Run for, I think, 8 years now. I've been in Middletown as a pediatrician since '95. And I haven't had a lot of free time, but I do like to walk. So I've been getting either one or both of my sons, and we've been exploring new parks where I can walk. So we've been doing that, and it's been fun. And to tell the truth, anything that I do with them is fun. So that's what I've been doing.
Great. Dr. Dummett, I think certainly as a pediatrician, it's always, I think, easier to relate when we're taking care of our own kids. Not that we're necessarily better at it than anyone else, but how many kids do you have and how old are they?
Oh, don't ask me how old they are.
Teenagers, young adults.
So I have 2 boys. One's 29 and one's 26. I had them when I was 10.
And of course, you're done parenting them, right?
No.
That's
a fallacy. You're never done parenting them, okay? Great. They have their own place, and I love it. It's a beautiful place, but I go and I'm like, well, that needs cleaning, and how come those dishes are there, and why are your clothes like, on the floor instead of the laundry basket? It's never done. It's never.
All right. Well, you let me know if that ever happens, because I'm looking forward to that. I wanted to also welcome and thank you for joining us, Dr. Pat Lynch. So Pat, go ahead and introduce yourself as well.
Great. Good evening, everybody. It's great to have you guys here. I've been a pediatrician for about 26 years in this area. I've been with Crystal Run also about 8.5 years or so. I'm happy to be part of an organization who has supported our learning, teaching, and our community. I have 5 kids who keep me pretty busy and involved in activities, so I definitely practice what I preach. I keep them as much as I can off electronics and involved in activities that take us outdoors. We take our education very important as well. And so, you know, that's sort of what we do. We have been trying to stay busy with more biking, which isn't something that we did a lot in the past, but biking is a little bit easier than, say, running, which can be painful at times. So we've been walking and biking and reading a little bit more on our devices. I like to read a lot, and the libraries are closed. That's been like a hard thing hit, but we have been adjusting to reading a little more online. So
great. So I came across something that's interesting, and for parents at home, I'm sure you guys are doing these things, but the top 5 things that people have been doing during the pandemic are getting creative in the kitchen for any sourdough bakers. A second one is a Zoom happy hour with friends, gardening, a new hobby, and exercise. So I suspect you guys have been involved in a lot of those things at home. So just first, before getting into the discussion, I just wanted to kind of level set where we're at here in the Mid-Hudson Valley area. I think we're all aware of this as parents, and we're all kind of I think happy to be maybe on the other side of what has been a difficult 3 months. So it's hard to believe, but it was almost 3 months ago that we had the first cases of coronavirus here in the Hudson Valley. And as we all know, this region has been hit pretty hard. Not as hard as New York City, but certainly much harder than a lot of areas of the country. We have offices in Rockland, Sullivan, and Orange County, and the numbers of cases in Rockland County are over 13,000. Orange County a little over 10,000, and Sullivan County about 1,500. The peak of cases was back in the beginning of April, but now we're seeing across the region about 7 to 10 new cases a day. And so we thankfully are getting to the point now where there are less cases. And as a result, I think everyone is aware that New York State has been opening businesses and allowing things to return to a new normal, but to have people doing things now that are getting out a little bit more and revisiting some places that they were before. We've been open this whole time. You know, we're an essential business. We provide, I think, a really important service to children and families and patients. So we've been open, but we've missed you. And, you know, we've done a lot of things during this time to prepare for and be ready and to welcome everyone back. And so we're happy to be here to talk about that. One of the other things I think that we wanted everyone to be aware about is that I think many have noticed and noted the reports that while everyone has been concerned, rightfully so, about coronavirus, many have stopped seeking regular health care for things that typically they would have been receiving treatment for. And that could be adults with chronic conditions. And we've seen and been concerned about people with things like diabetes and cancer and heart disease that haven't been going to the doctor, and that those conditions have been worsening. Additionally, we have noted across the country, and this has been reported by a variety of sources, including the CDC and the American Academy of Pediatrics, that children have not been coming to their pediatricians for well visits, and that immunization rates are down. So our professional society, the American Academy of Pediatrics, released a statement a few weeks ago and essentially said, and I think we strongly believe too, that the American Academy of Pediatrics strongly supports the continued provision of healthcare during the COVID-19 pandemic, and specifically well child care. Since the onset of the pandemic, a significant drop in well child visits has resulted in delays in vaccinations, delays in appropriate screenings, and missed opportunities for anticipatory guidance for keeping our children healthy and safe. And the last thing that the AAP has really stressed is that although telehealth has been a key part of keeping in touch with doctors during this time, that well visits are best done in person. In fact, it's actually, at this point in time, at least, most insurances don't allow for well visits outside of an office visit. So at this time, as we've reopened across the region, and as we've seen many of our parents and families coming back, we wanted to take the opportunity to tell you about well visits and vaccines at Crystal Run. So first, I wanted to ask Dr. Dummett to talk about well child visits and give us a sense about what you've been noticing and why they're important.
Thank you, John. So I'm going to echo a lot of what Dr. Nasser said, but just dig a little deeper into that. So the past 3 months, we have been sheltering in place as we try to stop the spread of the coronavirus. As our state, region by region, starts to reopen and face this new normal, we need to come to grips with returning to what used to be everyday activities: shopping, going to the barber, eating out, and yes, doctor visits. Because of the pandemic, we were afraid to bring the kids out, especially to the doctor's office. The fear of making them and sometimes ourselves sick prevented that. In New York City, from March 23rd to May 9th, immunization rates dropped 63% overall. For those 0 to 2 years of age, it fell by 42%, and it fell by 91% for kids over the age of 2. A CDC study of vaccines purchased through their Vaccines for Children program found that vaccines purchased March 23rd was 39% of what was purchased on March 2nd, before the shelter in place, for kids less than 2 years old. And for those over 2, it was 3.7% of what was purchased just 2 weeks prior. The World Health Organization has warned that this decline in immunization rates will increase the risk of preventable illnesses, and Dr. Lynch will speak more to that. We know that this drop in immunization rate is due to the steep decline in well child visits. Here at Crystal Run, we saw a low of 25% of visits compared to last year of our well visits for kids in the second week of April. Since then, there's been a steady increase. I'm here to tell you why well child visits are important for children and adolescents. The American Academy of Pediatric has outlined the purpose of well child visits, and I'm going to summarize that for you. First of all, the newborn visit, done 1 to 3 days after baby is discharged from the hospital, is needed for the weight check, feeding evaluation, physical exam, and checking on the well-being of both parents. It's also important for staying up to date with immunizations. The vision and hearing screening is done at the well child visit. We monitor growth, blood pressure, and other vital signs that can indicate the onset of a new chronic illness. Simple lab tests to check for anemia or high cholesterol or triglycerides, also done at well child visit. Routine blood lead screening done at the 1 and 2 year old visits. And then for the adolescents, addressing their health concerns such as acne, menstrual problems, depression screening, and school progress. BMI screening to assess for childhood obesity. Unfortunately, with the stay-at-home order and closing of schools, there's been no gym class, no school sports, there's no walk into school, there's no walking, between classes. Boredom has set in at home and turned to an increased time sitting on the couch and binge watching shows, movies, playing video games, and nonstop snacking. We understand that for some families, coming to the doctor's office is still a leap of faith. But let me tell you what we're doing here at Crystal Run. At Crystal Run, all patients are screened according to CDC guidelines before you can even schedule an appointment. And again, you're screened before entering any building. We have eliminated the waiting room and initiated no contact check-in. Patients check in from their car and go directly to the exam room. As much as possible, patients should only be accompanied by one parent. That parent also has to be screened before they're allowed to enter into the building. Everyone over the age of 2 is required to wear a face covering. All employees and providers in direct contact with patients are wearing appropriate personal protective equipment as directed by the CDC. We have increased the frequency that our office and buildings are cleaned. The last thing I wanted to touch upon is someone asked me, well, what's the best time for a well visit? What's the best time of year? I would say summer. Kids are usually less ill in the summer. There's no cold and flu that starts in the fall and goes through to the winter season. Allergies are in the spring. In the summer, they're usually doing well. Physical and immunization completion can be done before upcoming school year. All camp physicals for varsity sports can also be performed. And for those rising college students, they can get their physicals done at that time. There's no need to miss school and maybe work days. And as a reminder, we do have weekend hours for school physicals in the summer months to accommodate busy parents. The well exam is an opportunity to thoroughly assess your child and adolescent, answer both of your questions, and hopefully learn how to do better. As the American Academy of Pediatrics says, let us take them off of your hands for 15 minutes or longer. Thanks for your attention. Back to you, John.
All right, great. Thanks, Jocelyn. So just Jocelyn, one question I just wanted to ask you on behalf of families. Is there anything in particular that that parents should prepare for? How can they prepare to take best advantage of their well child visit? What should they bring? What do you recommend that they do to kind of get ready to come in for this visit?
So I always tell my parents, bring your questions. You know, you get to the doctor's office and you have 20 things you wanted to ask me, and you can only think of 2. And you're sitting there, you're just racking your brain. Write it down. Everybody's smartphone has a notepad. Just bring your questions. Bring your questions, bring your kid.
Right,
Your forms.
Great. So,
and your forms, yeah.
your forms, yes.
And your forms.
So I did want to then shift gears to ask Dr. Lynch a question, but I forgot to mention early on that Dr. Lynch and I are both at the camp, but we are social distancing, so we're actually at different campfires, so just in case anyone was concerned about that. So, so Pat, just in terms of vaccination, so you know I mentioned early on some of the concerns, and Dr. Dummett shared as well regarding a decrease that we're seeing in vaccinations. What are you noticing, and what are some of your concerns as a pediatrician during this time where children aren't coming in to receive their vaccines to the extent that they would in past times?
That's a good question, of course, and I'm not as formally prepared as Dr. Dummett, who did such a great job at talking about the well checkups there. I mean, I think part of being a pediatrician, taking care of kids, is vaccinating them so that they don't get some of the illnesses that I've actually seen kids have. And so what worries me is when the kids miss their visits and the rates of coming in and getting vaccines has dropped actually below 50% in the nation, and even worse for populations of Medicaid have dropped down as low as 34%. It's very concerning. Everybody's been home for the last couple months, staying safe in their homes. And so your risk is minimal if nobody's leaving your house. But now that America's opening up and New York is opening up, you're not going to be protected when you're home anymore. So you're exposing your kids out there to, you know, everything that they could possibly get. So that concerns me that our vaccines have dropped significantly. The amount of vaccines that we purchased compared to April last year is 25% of what it was. So we know we're seeing less, we're vaccinating less, at a time where, yes, we do tell you to stay home, but we also tell you to be healthy and come in and get your checkups and get your vaccines. The measles and pertussis vaccines I worry about the most. We just had a major outbreak of measles last year that we got under control, and pertussis is still out there in the community, and these little kids are most at risk for it, which is why parents get vaccinated when they're pregnant for pertussis. There is some maybe data during all this coronavirus that says that being vaccinated with measles can be protective for not getting COVID-19. So I encourage all the parents and kids over 1 to come and get their measles vaccine as well, as that is pretty important. Herd immunity usually occurs when we have kids that are vaccinated up to 93 to 95%, and we're not even coming close to reaching that now. So whereas all these people which didn't participate were protected in the past, we just don't have as much protection in the community. So again, a good reason for us to reach out. The CDC is worried about the decrease in the kids getting vaccinated, and the amount of vaccines that they've ordered through the federal programs has dropped dramatically as well. We see the numbers as well, and they are seeing those numbers through April as well have dropped significantly. So we're here to reach out to the community by doing something like this Campfire presentation to just inform you guys that it's important to stay up on your well checks, come in and get your vaccines to keep you healthy. And this year especially, I've told everybody coming in, please get your flu vaccine. Going forward, of course, the flu can very much mimic coronavirus. And if you get vaccinated with the flu, that's one less thing that we're going to have to worry about as we all kind of approach what's going to happen in the fall with our kids either going back to school or going back to college. And then, wintertime gets hurt so much. So, get vaccinated with the flu vaccine. And I really encourage them to do that. So that's kind of it in a nutshell.
Actually, a question came in from a parent. If you could just maybe just give a little more detail. Someone submitted a question wondering at what age is the measles vaccine recommended. Maybe you could just explain that.
Sure. So we had to address that last year during that outbreak. We started to give measles vaccines to kids from 6 months and above. The kids that were living in Rockland County, especially that were exposed, we gave them that vaccine 6 months and above, which is safe to do. It does, however, mean that you still need 2 measles vaccines over the age of 1. So they may get 3 total, but so as early as 6 months, a booster at 1, and then you can get a booster as much as 4 to 8 weeks after that, as long as you get them before you go to kindergarten. You need at least 2 in between the ages of 4 and 6.
And just to clarify, the period of time of recommending the measles vaccine less than 1 has ended, but we were doing that last year.
Correct.
In terms of the circulating measles in the community. So great. Another question came in actually from a parent who I recognize, but thank you for joining. This question was actually, it could be for either, but the question was, are we seeing children for well visits in a different building than children who might be sick? And I guess maybe I can ask Dr. Dummett to start with this, but how are we seeing children that might have symptoms of COVID or symptoms of illness and keeping them separated? And how can parents be reassured that if they're coming in for a well visit that they're not around other sick patients?
So at the present time, we've been seeing our sick children in a different building from the building that we're using for our well visits. And don't forget, if that should ever change, we would still separate them at least by time of day. But what I wanted to focus on is the fact that we do have the no waiting room check-in, that you check in from your car, you're greeted at the door by whoever's medical assistant you're seeing, you're taken straight to the exam room, seen there, and then you just leave the office after that. Something I've been trying for the last 2 weeks, I'm really trying to get my well visits down to a shorter period of time. So I've been having my MA actually make the appointment for the next visit before the parent leaves, so that you come into the exam room, I come in, I see you, you get your appointment, and you're out of here. Not that we don't love having you, but just to limit the time that you're in the office. I hope that answers at least part of your question.
We did have another question if you wanted to answer this. One of the parents were asking if we know how soon the flu vaccine will be available this year.
Typically get it anytime after September 1st.
Mm-hmm.
And we're hoping this year to get it by mid-August. And as soon as we get it, usually we get it, we wait a few weeks, and then we start to immunize. But this year we plan that as soon as we get it, we're going to start giving it out. And to tell the truth, I'm going to be the first one online.
Great.
I apologize. There was a bear or something over there. I suddenly had to leave, but I'm back now. It turned out it was just someone's large dog. So I apologize about that. I understand you answered the question about the influenza vaccine.
Yeah.
Right. Okay, great. I don't know if I cut out, but I hope the folks got the gist of the answer regarding where we've been seeing sick and well children. One other thing that a couple of questions are coming in, and we've heard a few about this, and we can tackle these together. And maybe I'll ask Pat to start with this. So parents are wondering how they can start to socialize again, and when is the right time to do that, and what things might be safe. I can tell you, because I'm interested in your answer, Pat, my 17-year-old daughter has been really asking a lot about, can she go over to a friend's house, and and what can she do there? And we've been sort of working through a lot of those things. So I'm interested to know what you're thinking about this and what you can share with families about socializing.
Sure. So just a couple things to talk about. Of course, anybody that really has any symptoms, anybody that's sick or has a headache or fever, you shouldn't really be in contact with them until you're sure that they're not sick with something more serious. So whenever there is any socializing going on, try just not to be around anybody that's been sick. And there's a couple rules of thumb. The more time you spend with somebody, the more you're at risk. The closer in space you are, the more you're at risk. And the more people you're around, the more you're at risk. So of the things that you can do, things with the highest risk at this point are indoor eating, indoor religious services, large outdoor events where social distancing is difficult to do. Nightclubs are kind of a no-no. And malls are varying. They're not open here, but they are open in other places and certainly out of our area. But those are the areas with the highest risk. It turns out that if you're outside, using a pool, being outdoors, camping, going to hotels and being on vacations are pretty low risk as long as you follow the guidelines and socially distant, wear a mask when appropriate. So
and I think the other, yeah, if I could just add on that, Pat, one of the things too is, a lot of what we do as pediatricians is talk to parents about modifying risk. Yep. You probably have never come in and not had us ask if someone's wearing their bike helmet. Yep. One time I was driving in a neighborhood and I saw a patient of mine not wearing their bike helmet. Couldn't believe it. We ask questions a lot about that, and we talk about reducing risk of injury and whatnot. And so I think one way to frame this socialization is to think about how can we do things. We know it's risky for our kids to not have social interactions, correct, but how can we limit their risk as they start to do those things again? And I think one of the things that we can take a look at as well is what the current situation is of disease activity locally. So right now it's low. So going out and doing some of these things still with precautions is less risky than it was, say, 6 weeks ago or a month ago.
Yep.
Jocelyn, Dr. Dummett, anything to add on that in terms of socialization?
No, I loved Pat's answer, and she's absolutely right. It's the amount of time you spend with someone, the space between people, the number of people, so less, unfortunately, is better. And the place outside always, at least now, outside less risky than inside. And John, you're right. It's like, yeah, you really have to weigh the risks versus the benefits of like everything you do. It's a new world, but that's where we are right now.
One of the other things I think is that I think some people are wondering about, and I don't know if we know the answer to this, but maybe one of you guys wants to answer. Do you have to wear a mask if you're outside?
So I'm going to tackle that a little bit. If you're outside and there's no one around you, and that sounds like, oh my gosh, like, when is that? So sometimes I'll go for walks in my neighborhood and I'm the only one out there walking. I don't wear a mask. If I'm on a trail, however, and I'm constantly like passing people, or people are constantly passing me. Like the other day, my boys and I went walking through Central Park. That time I did wear a mask. Even though you're passing people, I'm still close enough that I need to be protection against, from them, and they need protection from me. I went bike riding recently, and I wore a mask. I probably didn't have to, but if I'm not sure, I'll wear a mask.
Okay, great. Another question, and I'll ask you guys, but I also want to refer folks to our website on this question. I'll ask the question first, but the question is about a return to sports. And I think, again, I think a lot of kids are wondering about this, as our parents, in terms of the safety of returning to sports. And specifically, the question that we got had two sports in mind, and they're actually different. So I think the answer may be different, but the two sports are baseball and soccer. So Pat, I don't know if you have a thought about a return to sports and the timing of that. And then I'll let Dr. Dummett jump in and Jocelyn jump in, and then I'll give parents a reference on this too.
I do think what's happened recently in the community, because I've had some parents come in saying that their softball teams and baseball teams have started some practices practices with kids under 10. I think the NCAA just came out with something that really talked about how the athletes returning to college, sports like, you know, cross country are going to be easy to start because there's so little contact with them. The worrisome thing is a sport like football, which has got much more contact, much closer quarters. So we are going to start opening up and returning, but things like baseball and soccer where you're not, and cross country, you're not really as high of a risk because you're not always on top of another person, and you can be a little more apart, are probably going to be safer. And there's less volume of people on top unless you've really been to some of those cross country meets where, like, you know, all those kids are together, but still less contact, shorter period of time, fast moving. So you're not in somebody's face as much as you are when you're in football and facing somebody else. So, you know, the hope is that the rates go down so low that these activities may be safe to do in the next, you know, couple months. But for now, I think activities like, you know, baseball, softball, running are probably your safest to start doing.
And I think I know that some of the soccer programs locally have started doing practices, but they're doing specific to soccer. They're doing individual skill work where children are in grids. So they're not doing scrimmaging, they're not with each other, but they're together in the same place with a coach working on specific sports related skills. And, you know, I think for the contact sports, and soccer is sort of a close in-person contact sport. It may not always be as physical as, say, football, but for those sports, you know, I think this summer for children who are doing those should be focusing on skill development and not likely to be able to play in the same way that they were previously. So I did want to just mention, at Christa Run, we have a really great sports medicine physician, Dr. Justin Conway, who has written a blog about a return to sports with COVID. It's on our website. If you go to www.christarunhealthcare.com and go under blogs, you can read about that. And he has some great advice, both about this issue about what sports, but also how to prevent returning to sports and getting an injury for all ages, but also for children who had been very active and maybe haven't been as active during this most recent time. So I would encourage you guys as parents to check that out for more information. And I know this is an important subject, and we've thought about inviting Justin to come on a future episode as well if there's additional interest. So great. Another question that I just wanted to bring up here, this is another sort of question about socialization and again about masks. And this question is, what about masks for one-on-one play dates for children that are outside? And I don't know if either of you guys want to take a stab at that, masks for play dates.
If they're playing close to each other, I would say yes. That's kind of my simple answer. I
mean, that's the
safest. Some people are having play dates where, you know, they're going to practice social distancing, bring their own lunch, which they should. And, you know, maybe not so much for that, but if it's, you know, someone that you haven't seen in a while and, you know, you're going to be, you know, outside together, you know, playing on the swing, playing tag, my answer would be yes.
Yeah, I think one of the challenges, and I don't know how old the child is, because the play date term is usually used for younger children, may not be, but I think the challenge is for the 3 and 4 and 5-year-olds. Wearing a mask outside can be difficult.
Keeping it on.
And one strategy that I've seen talked about for this, which is one to consider, is to have again, it's all about risk modification. But if you have 1 or 2 families that are your families that you're sort of extending your social distancing to, that you know that they're not seeing 3 or 4 other families with their younger children, that one strategy is to have slightly increase your social distancing safely, to use masks wherever possible. But if you really have younger children that's not feasible for, that if you can at least limit the exposures of the other folks, that can provide some potential safety to you. Again, it is not zero risk. You know, the lowest risk is staying home, but we know that that's not always feasible. So sort of a step past that is to consider interacting in that way where you have limited exposures to other people. and that you know are being safe like you are.
And just to piggyback on what Dr. Nasser said, we do not recommend face coverings for children under the age of 2.
We struggle with the kids in the office actually wearing masks, sometimes even older than that. And so that is a struggle. And if you've ever tried to wear one out there playing, walking, or running, it is quite difficult to do. So limiting the play date amount of people is probably a better idea. If you've been with this person, like some people have been in daycare and private day, with families watching their kids, and I've had parents come in saying, Johnny's always with Susie, like all the time. If they've been together for the 3 months, they're probably safe to stay that way. But it's new play dates that you would have to just be more cautious.
Another question, again, I think a lot of the challenge on this, to be frank with parents about this, is that the science is changing a lot, and we've heard some recent information that maybe is contradictory to what we've heard early on. But this question has to do with playgrounds. So, what can we share with parents about whether playground equipment is safe to let their children play on?
From what I've seen from kind of walking in different parks, at this point, they're all closed. If it comes to the point where a playground is open, I would recommend taking a bunch of wipes in a baggie. And before your child, and I'm assuming these are younger children, like, gets on the swing, gets on the seesaw, grabs the monkey bar, just to do like a quick wipe down. After they come off of each piece of equipment, I would recommend sanitizing their hands. And again, social distancing. If that playground opens and every family's out there trying to get their kids in, because heaven knows we've all been like stuck in the house for 3 months, then that's not the time to go. So either go really early in the morning or later in the evening when it's less busy and you can safely social distance. And really teach the children that, we're in the playground, but we didn't really come to make new friends. So, if they see another kid, they can certainly be friendly, but, just remind them they really have to keep their distance. And if it's not possible, it's time to, pack up and go home.
And the wipes was a great idea. No, but the wipes is a great idea, because we have no idea whether these parks are getting cleaned, whether they're getting wiped down. I mean, are they safe? People bring their sick kids out, so they don't stay home. So that was a good tip, to make sure you just have a baggie full of wipes so you can, wipe your kids' hands down. Wash, again, your hands as much as you can, just to keep them away from your face if your mask is off. All of that is really helpful.
So there's one final question that we have, and I think we're almost out of time. But this question, just to paraphrase it, is a question about what can we tell parents about whether or not it's safe for children to go to camp and daycare. How can parents be reassured about camps this summer, and what they can do in terms of sending their children to daycare again. And I know this is an important topic for many of you at home, because as we move into phase 2 businesses, some people are actually going back to work and have been at home for a while now. So I'm going to share 2 things about this, and then I want to end with one comment. First, the CDC and New York State have recently issued guidance for safe opening of both daycare and camps. And I think checking out their websites on these topics would be helpful. The general gist of that recommendation, though, is as follows. No one should go if they're feeling sick. Everyone that's working there needs to also be screened clinically to make sure that they're not sick. Distancing of children is critical. Avoiding kids coming together, really important. And also making sure that there aren't sharings of food and the like. But I also wanted to share with you that it's a great question, and it's actually the topic of next week's show. So next week, we're going to have Dr. Jangda and Dr. Kumar on to take a deeper dive into camps and daycare, and we'll probably also hit on the return to school. So if you can't wait until next week, you can check out those websites, or even better yet, call your Crystal Run pediatrician, because we'd be happy to talk to you about that if you're having to make decisions about camp, because I know that New York State is allowing them to open the last week in June. And so if you can't wait until next week, or you want to talk to us more about it, give us a call. But please join us again next week, because we're going to really talk in detail about those two topics. So before we're going, I want to really thank everybody for attending today. But I wanted to just close with a final question for Dr. Dummett and Dr. Lynch. And that question is, what is your best advice to parents and families for navigating through this time and maintaining health and wellness for their children? So this time I'll put Dr. Lynch on the spot first.
I think sticking with structure is probably the most important thing. I think with the kids being out of school and not having any timetable, it's been hard on them. So, you know, have a bedtime, have a time for them to get up, have some structure in your life, because we all do better with some structure and activity. Make sure that you're doing some form of activity every day, some exercise, get outside, get some vitamin D, get some sun on your skin, and try to have a good time and enjoy your family.
Great, thanks. And Dr. Dummett.
So Dr. Lynch, I love that answer. So the advice I give to my parents on staying healthy is, you know, we think we drink more water than we actually do. So lots of water, lots of veggies. This is not the time for, you know, French fries and chicken nuggets. Get those kids eating their vegetables. Get them to bed on time, get them up early, and get outside. I think if we did that, we'd be fine.
Great. Well, we're already outside. The fish are biting. We've got to go. Thank you guys so much for joining us, and please tune in again next week for our Campfire chat. Thank you all. Thanks, Dr. Lynch, Dr. Dummett, and thank you all for joining.
Thanks for having me.
Thank you.